All right, that was a really quick transition. Welcome back. We're here with Dr. Sarah from Lone Star Pediatric Dental and Braces. You are amazing. You're our personal dentist, and we love you. And for those that follow us on Austin Moms, you're probably used to seeing Dr. Sarah's face. We do lots of Facebook Lives with her. So thank you so much for joining us this morning. We appreciate you having you here.
Thank you so much. I'm so excited to be here. I'm excited that everyone's on here listening. I got to listen to Dr. Adeni this morning, and she had some great advice. I'm a mom. Trust me, you need the self-care. I know that Dr. Walker is going to be on here later, and Dr. Walker's my OBGYN, so I highly recommend her. She delivered my baby. She's amazing. And then I also know there's a lactation consultant, Tanya Knudsen, that's going to be on here later as well. And she was my lactation consultant as well. So I highly recommend. I'm so glad that you guys are here and learning about everything that you need to know as a new mom. Trust me, it's hard. Trust me, you want all the information, and I know it's a lot. But anyways, a little bit about me. I am Dr. Sarah Carpenter. I am a pediatric dentist. And I am a mom. So I have two daughters, a 3.5-year-old and a 1.5-year-old. You can see their pictures right here. And my hobbies are wake surfing. There's me wake surfing with my husband. And I also love to snowboard. And then you can also see that picture of me with my work family. We're all festive for September 11th, supporting our troops, wearing our camo. And yeah, so I live in Spicewood, just west of Austin. And I love my kids and I love my job. And I'm a pediatric dentist at Lone Star Pediatric Dental and Braces, but I specifically work at the Bee Cave office. We do have several offices. And let me just pull up here. So we have 12 total offices in the Austin area. So you can probably find us somewhere. We have north of Austin, there's one in Belton, Killeen, and Copperas Cove. Then in Austin, we have some in North, Central, and South Austin. And then we have one in Elgin, I'm in Bee Cave, and then Circle C in Dripping Springs. And then south of Austin, we have Kyle and New Braunfels. So we are specialists in children's oral health. We provide comprehensive care for children aged 6 months all the way through 21 years old. We have a lot of different type of specialties at Lone Star. So we have pediatric dentists, orthodontists, and oral surgeons. So as a new mom, you might not have even thought about your kids' teeth yet. That's probably not something that you think about as a pregnant mom. But it is something that you should consider. You do want to take your kid to a pediatric dentist. We specialize, we have an additional 2 to 3 years of specialized training in residency after dental school, just to focus specifically on children. We learn all there is to know about child development, child psychology, and child behavior. We have special techniques and modifications to make it easier for children. Going to the dentist can be a little nerve-wracking for some. So we have different things that we can do at our office to help their appointment be as easy and fun as possible. We are capable with treating children with special needs or disabilities. But most of all, we make it fun. So we sing songs and we show the kids what we're going to be doing prior to actually doing it so that they feel comfortable, and we gain their trust first. And then, we have like bright colors on the walls and paintings and TVs on the ceiling. And our goal is to make sure that each child leaves with a smile so that they want to come back to see us. Our office is just geared toward kids. We remain busy because our patients continue to come back every 6 months. And we love watching our kids grow up. So yeah, we try to make it as fun. You can see the picture there is my two daughters at the dentist. My 3-year-old wanted me to paint Elsa on her tooth. So now she has an Elsa tooth that every time I brush her teeth now, really all I did is I put a sealant on her tooth, which just helps prevent cavities. So you can talk to your dentist about possibly doing that for your kids too. But yeah, so that's how, she got really excited to get sealants on because we painted Elsa on her tooth. And another thing as pediatric dentists is that we mainly focus on education and prevention. We know how terrible adults can feel if their mouths are not in good health. And so our goal is to teach them at a young age how to take great care of their mouths, and also teach the parents how to take care of their children's mouths so that their children can grow up with happy, healthy teeth. So here's a picture of me reading a book about diet and which foods are good for your teeth and which foods are bad for your teeth. And actually, if you want to look in the handouts section, I put some files there that you can actually show your kids if you want to save them for later, and go over with them which foods are good for your teeth and which foods are bad for your teeth. So yeah, we talk to them about diet. We talk to them about how fluoride works and how fluoride can make your enamel stronger. We talk about how bacteria are the sugar bugs that can cause cavities. So we put it in terms where they can understand. And then also, I know that a big concern now is COVID and keeping everything clean as possible at the dental office. Since we are working in the mouth, we do have to wear 2 masks as employees. So we wear an N95 mask and then another mask on top of it. And then when we are actually, so you can see me and my team wearing our double mask. And then when we actually see the patient, we also wear a face shield. We wear disposable jackets. And we're really adamant on keeping everything 6 feet apart, sanitizing everything. We already sanitize everything even prior to COVID. Obviously, we have to sanitize everything. We actually treat every patient almost as if they have HIV. Like, we clean everything, sanitize like crazy. But now we're also eliminating aerosols. We put up wall partitions to keep people apart, and we take the temperature of everyone that enters the building. Everyone has to wear a mask. We try to keep the families together so that their families aren't spread apart throughout. We did have to eliminate their treasure boxes, so there's no kids digging through the prize box, but they still get a prize. They just don't get to dig through the treasure box. And we also reduced their waiting time in the waiting rooms, just so everyone feels safe. So I am going to be covering today how to care for your child's oral health depending on their age. So I'm going to be talking about how to take care of your teeth for infants, toddlers, elementary school, and middle school. And I know that this is aimed at new moms, so I'm assuming that most people don't have high school kids, but you never know. All these things that I'm going to be talking about, there's no shame or judgment if you messed up or if your kid got cavities, or, honestly, my daughter had a cavity, so it's fine. But I just want you to know that all this is just information. There's no judgment. I know how hard it is to be a mom and how hard it is to keep going with day-to-day things. And sometimes, things don't happen the way you always want it to go. But our job as pediatric dentists is to give you and your child as much information as possible so that you and your child can succeed and have a healthy mouth. So infants, I'll get to frenectomies in a second. I know that's my first bullet point, but a lot of people don't realize that you actually do want to take your child for their first dental appointment by their first birthday or when they get their first tooth. So when their first visit, you can see the baby's just laying in my lap. It's a very quick appointment for the kid. We're basically just looking in the mouth to make sure everything looks healthy, that the teeth are coming in how they're supposed to. We show you how to brush their teeth properly, and make sure that all their gums and tongue and everything's healthy. Their first tooth usually comes in around 6 to 9 months, and that I see. Sorry, I'm reading the questions. You asked if we have any tie specialist on staff. So you're talking about lip tie or tongue tie. So I am a lip and tongue tie specialist, and for children who have a lip or tongue tie, we do offer frenectomies with the laser, which I'll talk about in just a moment. And so as far as infants, the way that babies get cavities, yes, babies can get cavities. The most common cause for that is baby bottle tooth decay. So that's usually from falling asleep with milk on their teeth or juice, just falling asleep with the bottle in the crib. So you don't want to, if you're feeding your baby, you want to be holding your baby. You don't want to put them in the crib with their bottle. Because even breast milk, any kind of milk is very thick, and it does have natural sugars in it. So if it's sticking on the teeth all night long, it can cause cavities for the babies. So ideally, in an ideal world, you would feed your baby, wipe the teeth, brush the teeth, and then put them in their crib to sleep. I know how hard that is. So I know how hard it is when the baby's falling asleep while feeding. So if you need tips on that, I'll go over that too. As far as teething is concerned, some kids have a lot of pain with teething. Some kids have none. So cross your fingers, your kids have none. But if they do, if it's really severe, you can give Motrin or Tylenol. If they're really fussy before bed, they're not sleeping, crying a lot, you can give Motrin or Tylenol. If it's just a little fussy during the day, it can be like if they're drooling a lot, they're sticking their fingers in their mouths a lot. You can even notice like a little rash if they have a lot of saliva on their chin. It causes a little rash on their chin. A fever is not typical for teething. If it's below 100.3, then it can be from teething. But if it's above that, you might want to take them to a pediatrician because they may have a virus or bacterial infection or something. But other things you can do for teething is you can cold things help soothe the gums. The reason they get teething pain is usually from inflammation of the teeth pushing through. So biting on something cold helps reduce inflammation. So my daughters loved frozen watermelon, frozen bananas. There's the cold teething toys that you can put in the fridge. Or there's actually also it's like a rubber silicone banana toy that has it looks like a toothbrush kind of. Doesn't really clean the teeth very well, but it does massage the gums and helps with teething. So let me pull up my slide on frenectomies really quickly, and I'll talk about this. So sometimes babies can have difficulty with latching, difficulty breastfeeding. I personally had this issue, and so my daughter had a lip tie, and I ended up doing the laser frenectomy on her, and my symptoms improved drastically overnight. And it's not always the case, which is why I would have to evaluate your baby first to see if it's really needed. A lactation consultant, specifically Tanya Knudsen, is amazing and does help a lot with this as well. So it can either be a lip tie, which just means that the attachment that attaches the lip to the gums is very short or thick, or it can be a tongue tie, which the attachment that attaches your tongue to the floor of your mouth is either short or thick. So either one of those things can cause difficulty with breastfeeding. And so if they're popping off with breastfeeding, if they're having difficulty gaining weight, if they have acid reflux, gassy or super colicky, or if it's painful for mom during breastfeeding, typically, if you get past the breastfeeding portion, like once a kid is like, say, 2 years old and over, it's more rare to need the frenectomy treatment in older kids, because usually as you get older, it gradually recedes and doesn't cause as many issues. It's pretty rare for it to cause speech impairment, but it's possible. So it's just something that your pediatric dentist would evaluate. So pretty much only if it's affecting your daily life, then that's when we would use the laser to correct it. It's a very quick procedure. It's very fast. You can see that photo is a picture of my baby. So the top picture is before and the bottom picture is after. You can see that the attachment there was pulling on her gums, and then the 2-week post-op photo is it's not pulling on her gums anymore. So it did improve breastfeeding for me personally. And I've had a lot of other moms with success stories as well. But it's just something that maybe you should know about before you start your breastfeeding journey, because breastfeeding is one of the hardest things I've had to do in my life. So we want to be on your team, and we want to help you through that process if possible. Okay, so that's a lot of information about newborns. Usually for newborns, the earlier you start brushing their teeth, like as soon as that first tooth comes through the gums, it's usually the two on the bottom down here. As soon as you first see that tooth, you do want to start brushing. So you can use a little toothbrush and start brushing just with water, just to get them used to cleaning. Most kids do not like having the parents brush their teeth. So if you start earlier and get them in that habit at a younger age, your life will be a lot easier as your child grows, and they become more independent. And okay, so that's infants. Moving on to the toddler age. Usually the kids will get all their baby teeth around 2 or 2.5. You can start flossing. You still need to be helping with brushing morning and nighttime, and you can be using the fluoride toothpaste even if they are swallowing it. That amount of fluoride that's in the kids' toothpaste is very, very minimal already. And if you're in charge of how much toothpaste goes on, you only want to use like the size of a piece of rice amount, so that it will benefit their teeth, but it won't harm their body if they swallow it. Usually we start taking x-rays around age 3 or 4, depending on cooperation level. And then the main reason why toddlers get cavities would be difficulty brushing. Like I said, most toddlers don't like it if you brush their teeth. So things that you can do to try to make it easier for them. Oh, I forgot to post the offer for the new patients. Hang on one second. So we have a complimentary lap exam for your first, there it is. For your first baby's dental visit, you can click that link and call any of the offices that are closest to you, and they'll be able to set you up with an appointment to meet the doctors, and so that the doctors will be able to go over with you what your child's needs are. Okay, so back to toddlers' teeth. So the main reasons why toddlers get cavities is either if it's difficulty brushing, or if they drink a lot of juice or Gatorade. Juice causes so many cavities in kids, so it's best if you can just avoid juice. Wait until they're a lot older. Try to drink mostly water or milk during the day. Juice doesn't have a lot of nutritional benefit, and it's very sugary, and I just don't recommend it unless it's like a special occasion, but not an everyday kind of treat. And then also other reasons why toddlers get cavities is if they eat a lot of fruit snacks or gummy vitamins, things that are really chewy and sticky. Gummy vitamins actually have 7 times more sugar than, say, like the chewable, like Flintstones, that are more powdery kind of vitamins. And the gummy vitamins just really get stuck in between the teeth. And so if you're not flossing, it can cause a lot of cavities. Even though you think you're doing something good for them by giving them vitamins, it's just not good for their teeth. Let me put up here. And then other reasons, things that you can do to try to improve brushing at your home. You can sing songs. There's YouTube songs about toothbrushing. You can let your child brush your teeth at the same time that you brush their teeth. Or you can get two toothbrushes and they can brush one side of their mouth at the same time you brush the other side. So they feel like they are doing something on their own. They think they're a big kid, but really they still need help. You can try having them lay down. You can try having them brush their teeth in the bath where they're already cleaning the rest of their body. They might be okay with cleaning their teeth too. So you can try those different things. There's a lot of other options, a lot of other tips that I have for you, but I'm kind of running short on time. I don't want to.
Comments in, we'll see if looks like some is able to hop um, you to Dr. Biden.
Can you hear me?
It's a major issue. Hi,
Hi.
hear you me okay?
I can't see you or hear you. Okay, I'll keep going. So,
Hi, can you
okay. I just saw some of the questions. What are symptoms of cavities in babies? So they usually start as like a little white line up along the gum line. And it looks like just a white chalky line along the teeth. And then as it gets worse, it turns yellow and then brown and then darker. And then it turns into a cavity, and then it would need to be treated. So basically, if there's a lot of milk or plaque stuck along the gum line, this is one of the hardest places to brush the kids' teeth because they tighten their lip and it's really difficult to get up there. And that's also where the milk sits when they drink out of their bottle. So that's usually the most common. It can also be if they have their back molars, it can be like little dark spots on their on the chewing portion of their molars. So that, but again, have your pediatric dentist look over that. Another question here, it says, my little guy, 2 years old, won't use the toothpaste. He says it's too spicy. So there's bubblegum brand, there's bubblegum flavors, there's strawberry flavors, and then there's actually a brand, if you look on Amazon, it's called Cha Cha Chocolate. That's chocolate toothpaste. Strawberry is usually the most common, most popular one for kids. So Crest has one, Tom's has one that's fluoride, that has fluoride. So if you buy the Tom's brand, some has fluoride, some doesn't. You do want to buy the one with fluoride. So those are, as far as like a specific brand. Oh, there's also one called Hello Bello that has a good brand as well. So those are just answering the questions that I saw over on the side. As far as elementary school, that's usually when they start losing their first baby teeth, and that's usually when they first start seeing the orthodontist. Reasons why they get cavities is usually from like a similar thing as toddlers. Either they're eating a lot of sugary snacks, candies. That's usually also when they can get, like, they start brushing their teeth on their own, so they're missing a lot of spots. So they still need help with brushing all the way up until age 7. Middle school is when they start to get all their permanent teeth in, and that's when they can start getting full phase of braces. That's when they can get the full set of braces. And sorry, I'm sending another offer for anyone who has teenagers and they want, or age 7 and up, they want to get a free orthodontic consultation to meet our orthodontic team. Dr. Craig is one of actually all of our orthodontists are great, but Dr. Craig is the one that I work with closely at the Bee Cave office. So I highly recommend him. And let's see. Other than that, hang on one second. Sorry, guys. Trying to move to the next slide. Can you move to there we go. So high school, that's when we usually just start evaluating for wisdom teeth. We'll take the panoramic x-ray to check for wisdom teeth. So that's kind of farther on down the line. I know that there wasn't a lot of people on here that had high school students, so we can move on to the next slide. Thank you. Yeah, so in summary, I know I just gave you a lot of information, I know that you're probably not going to remember it all. I know your life is busy. My life is busy. I'm sure your life is busy too. So our goal at your dental office is to try to get you in and out as fast as possible, so you're not just at the dentist all day long, but we want to give you our undivided attention while you're there, and to make your child have the best visit ever, even if it's something kind of scary. We want them to leave with a smile. The main point here is just to take your kids to the dentist every 6 months to get their cleaning and exam. The health of your teeth directly relates to the health of the rest of your body. So your dentist is not only checking for cavities, but also for crowding, how your teeth fit together, the health of your gums and your tongue. They evaluate your tonsils to check for breathing, and oral cancer screening. So I think I answered all the questions, but if you have any other questions, I'd be happy to answer them. But that's it.
I'm sorry about the technical issues. I mean, I knew it would happen, but to happen right in the middle of our title sponsor, I apologize.
No worries. We got it.
We got it. We got through it. Guys, this is the time to get your comments in before we go move over to our next webinar, which is with CryoCell. Thank you so much for joining us, Dr. Sarah. I know that today is your day off, so we appreciate you participating in Bloom. And Lone Star Pediatric Dental and Braces has been sponsoring our events and has been on our website for, gosh, like 6 years now. And we've been patients of yours specifically with all 3 kiddos. So I loved the part where you were talking about getting to watch them grow, because we've already had our consult with Dr. Craig for braces. So we're moving along. But thank you again, and you have a wonderful day.
Thank you. Thank you, everybody.
Okay, bye, guys.
Bye.